Dr. Rajneesh, please educate us about silent heart attack and also what's the difference between heart attack and cardiac arrest, because people often use the term interchangeably.
Yes, so this is a good question. Silent heart attack actually is a heart attack with almost no symptoms or very minute symptoms which people usually ignore. So people think that they had no symptom as in they didn't have any chest pain, no sweating. So these are the normal symptoms of heart attack. If these are not happening, and some acidity or gas happens, which are very minute symptoms, and people attribute some minor symptoms to hyperacidity or gas or erratic eating, but that could be a heart attack in those patients. So if heart attack is happening with very minor symptoms, this is called a silent heart attack. Now how do we come to know about it? So that person, if the person goes to a cardiologist or a hospital and finds that his heart function has gone down and ECG changes have come, and patient had no concrete history of any major symptoms, so then it's called a silent heart attack. The second part is again very important. The heart attack and a cardiac arrest, these are totally different terms. So heart attack is a situation where one of the arteries of the heart supplying blood to the heart muscle gets occluded. So one artery has occluded and patient feels a chest pain or discomfort or breathing discomfort or sweating. So these are the major symptoms of heart attack. So this is a heart attack, which necessarily does not mean that patient is having a cardiac arrest. Cardiac arrest when heart totally stops for a while. Now cardiac arrest is a peculiar situation whereby patient has to be salvaged within a few minutes only, otherwise we lose a life.
Right. So, what are the latest technological advancements in cardiology in India?
Yes, so cardiology actually is a branch where lot of technological advances have happened in last 2 decades and still happening. The latest have been that now we are changing the valves inside the heart. Now you can well imagine heart is a very small structure, and there are different valves in the heart, 4 valves in the heart. We can change those valves without any surgical incision on the body. No blood loss, no anesthesia. We go through groin and change the valve. So new valve starts functioning. The diseased valve is taken off, is not in the system anymore. It's squeezed beneath that rim of the new valve, and new valve starts functioning immediately. So this is a very big revolution in I would say in cardiology treatment, and we are further looking at many more technological advances.
Right. So, despite medical advancements and improvements in diagnostics, India has witnessed an alarming rise in the number of deaths owing to heart diseases. Where do you think we are going wrong?
This is very important, and in fact, we keep saying and we keep lecturing that there are infrastructurally we are very well off, technically we are very well off, at par with the Western population, but still the heart disease mortality is on the rise. And what actually is more disturbing or more concerning is that we are losing many young individuals to heart attacks despite everything. So I think we are going wrong, especially in an area that awareness is still lacking as far as the symptoms of heart attack are concerned, as far as uh, how to pick it early and reach a hospital is concerned. And also people are not aware of having a regular screening test on yearly basis. They don't do that. So health is not a priority thing on people's minds. So they can think of money, they can think of their jobs, everything, but not health. So that is where we are going wrong. We have to change this mindset of people that health should be a first priority over and above the other stuff.
Right. And what does the future of interventional cardiology look like? I mean, what is the major or miracle breakthrough you're expecting in the coming years that will change the situation, particularly in heart diseases?
So future of interventional cardiology has always been very bright, and it still is. It's going to be even more expanding. The horizons are going to grow further. As I mentioned initially, now we are changing the valves in the heart without surgery. So these are known as percutaneous valve replacements. we have conquered few valves. We have conquered aortic valve, but still the mitral and tricuspid valve disease, they also constitute a very big subset of heart disease. So we are almost now nearing uh, to reach a stage where we conquer and replace the mitral and tricuspid valves also percutaneously. I think that would be further miraculous, uh, episode happening in treatment of cardiology part.
Right. And how can we address the shortage of donors for heart transplants in India?
Yes, so this is very intriguing actually, that heart transplant program hasn't really picked up in India at a faster pace as compared to a Western population. We are lagging behind in numbers, and because of that, there are many patients who are end stage cardiac disease patients. We lose them because there is no concrete cardiac transplantation program. And why we have all the skill set, we have all the infrastructure for cardiac transplantation, but somewhere ritually and religiously people are not ready to donate their hearts, even after, obviously after the patient has been declared brain dead. So somehow our culture is not fitting into that. They think that no, they can't donate any organ, so ultimately they have to take the body and cremate, that's it. But no organ donation is talked about, or the mindset of families to donate organs is not there. Again it requires a huge level of awareness to be spread across.
Right. So, doctor, what according to you is the heart healthy diet?
Yes, so heart healthy diet is a diet which actually constitutes less carbohydrates, less fats, and more proteins. Some fats are definitely required for our body, but then it should be unsaturated fats rather than saturated fats. Also, there should be a restriction of trans fatty acids in the diet. So, trans fatty acids, basically, trans fats emanate from uh, repeated frying and more prolonged frying of any food item. So that leads to generation of trans fats. Saturated fats are again villains. Carbohydrates, mithai, are all villains. The foods which are available these days, the ready-made foods like pizzas, burgers, are actually having lots of trans fats in those foods. So these things have to be restricted. Now these are unhealthy. What are healthy are unsaturated fats, good carbohydrates which are fruit carbs. So all fruit carbs are considered good. Apples and papayas and any kind of fruits. Salads are considered very good. Nuts are considered very good. The almonds and the walnuts, they are very good foods, and all kinds of vegetables. So these are the good foods. One should have good servings of the healthy foods and restrict the unhealthy foods.
Doctor, work life balance as a doctor, especially being a surgeon, is quite a challenge. What works for you in finding balance?
This is very interesting. So I'm not sure whether I have found a balance or not, because it is a very tricky situation. We keep working very hard throughout the day, almost up till 8 9 p.m. Our work continues, and full day it's very clogged. But yes, at times, in on weekends, we plan a lot of things with the family and with my boys. We go out, and whether it's a movie or a dinner outside. So, and then, continuously in touch with the family, talking to them, knowing what is going on. I think this is the best way one can create a balance, because doctors' job has to be congested. I mean, there is no dearth of patients. Patients, they keep following you, and they have a lot of expectations. We have to fulfill their expectations. Once we start doing that, obviously that takes a lot of time from our personal life.
Right. And are there any books or podcasts that you're currently reading or listening to these days?
At times, I am a fan of some good web series. I follow those kind of web series. There are a few web series on Netflix which are very good. A Good Doctor is one web series where there is a autistic surgeon. You know how he has extra intelligence and he plans his surgeries. So this is one I really liked in the recent times. There was another web series that is offbeat web series, not related to medical profession. That is Madam Secretary. Again, that is considered very good. So I at times follow such kind of stuff.